Hi, and welcome to this overview of CIRCE for Crisis Centers. In this demo, we will discuss how the CIRCE system empowers counselors with easy-to-use documentation tooling and call integration. In addition, we'll discuss how your crisis center administrators can easily quantify counselor impact through robust reporting and analytics. Let's get started. When you first log into the CIRCE system, the homepage presents a newsfeed and dashboard that provides our counselors with the most relevant recent information they need to effectively take calls on our crisis lines. There are important announcements, open call notes that need completion, follow up calls that need attending to, and some of the recent calls that have come into those on shift. These data snapshots are especially helpful for counselors signing on to shift to understand the previous shift's call volume, as well as any restricted or banned callers to look out for. This page can be customized to the needs and priorities of your crisis center. Administrators can easily create caller profiles for callers at your center, whether they're frequent callers or otherwise, that includes a complete history of calls, any limits set with that caller, alongside relevant identifying information such as phone number, demographics, characteristics and background, self-disclosed medical history, location, and more. This feature empowers crisis center counselors and staff with the latest information relevant to working with the callers at your crisis center. In a caller's history list, counselors are able to quickly see most recent calls, date and time of those calls, which counselor took those calls, starting and ending risk assessments, and more. If additional context is desired, a simple click pulls up the individual call records in a new tab for easy reference. The history is sortable, and the columns are customizable to the needs and priorities of any crisis center. Directives and guidance provided by crisis center supervisors and staff are readily available, allowing for counselors to easily reference the best known ways to support callers in crisis who may have called before. Characteristics can also be added to help crisis counselors better identify callers. With the Zoom integration, we can see a new call coming in directly within the CIRCE system. After we pick up the call, because this caller is known to us, in other words, their phone number is attached to a caller profile, the system's robust search functionality quickly identifies the correct profile. Now we can begin logging our call note. With the native Zoom integration, logging a call note is simple. Initially, all crisis counselors will have to do is indicate the type of call, the line on which the caller is calling, and any other program-specific details for your center. After saving, with the Zoom integration, the call note will automatically capture the call's start and end time and map that to the identified profile. Within a new call log, counselors can easily view profile details and begin their documentation. The CIRCE system presents fields in a way that follows the natural flow of a crisis call and can be customized to the needs of your organization. Counselors can easily record a caller's starting and ending risk assessment, including starting and ending SRI for calls on 988. While risk assessments may default to not suicidal, in the event of higher risk or attempt in progress scenarios, the system allows a counselor to capture additional key details and supplemental information to better assist both the caller and their crisis center. In this case, let's say that this caller was medium risk. The caller has communicated to us that their self-rated intent is a level 3. Their timeline is within the next couple of weeks. The caller has shared that they do have suicidal thoughts, they do have a suicide plan, they have identified the means. We know, based on what they've told us, that these means are lethal, and they have communicated that they have access to these means. In order to keep the caller safe for our conversation, we have asked them to remove the means, to which they agreed. The counselor is also able to record and measure the caller's emotional state of mind, capturing critical elements related to the level of escalation for this caller at this particular point in time. This might include feelings of hopelessness, feeling trapped, loneliness, burdensomeness, psychological pain, thoughts of suicidality, and more. Now that we've finalized our initial risk assessment, we'll see that it populates here in the risk assessment summary. With the initial risk assessment complete, we can now move on to the call's theme and core call notes. Crisis counselors can easily identify one or multiple themes based on what a caller has communicated with them. Many crisis centers will use assessment, concerns, interventions, and plan as the framework for their documentation. However, this can be customized to the needs of your individual organization. As counselors are documenting call notes, they can leverage the CIRCE system's knowledge base to access any documentation guidelines or templates that you have. In this case, because our caller was medium risk, we know that we need to look for a medium risk template. Crisis counselors can now access the template you've provided in the knowledge base and simply copy, return to the call note, and paste the note into their call note for further editing. Options for a one-click template insertion are in development for future releases. The knowledge base can also be used to store documents related to mandated reporting or emergency checklists. Once completed, said documents can be uploaded directly to the caller profile. Once we've completed our call notes, we can also identify any other key information regarding the caller's disposition, as well as their cause of distress. Next, crisis counselors can indicate the final outcome of the call and also indicate if a referral was provided. Counselors can also identify the specific referral provided to the caller. Now that we've completed our call notes, let's take care of our final risk assessment. Based on what the caller shared with us, we've identified that they are now low risk, their self-rated intent has decreased to 1, they do not have a timeline, and while they may be experiencing suicidal thoughts, they no longer have a suicide plan. Now that we've completed our ending risk assessment, we will now see it updated in the risk assessment summary. Let's imagine a scenario where our caller's ending risk assessment stayed the same as their starting risk assessment. To ensure the caller continues to receive the support that they need, a follow-up call has been offered and accepted by the caller. Crisis counselors can create an outgoing callback to create a task for assigned supervisors and crisis center support staff for ease of tracking and reporting. These records allow the crisis counselor to provide context on the caller's situation, as well as the expected means, the self-care plan, and an indication of when the expected callback should occur. Now that we've scheduled our follow-up, we can see the parent call that it is attached to, as well as see the follow-up in the caller's recent call log within the profile. CIRCE for Crisis Centers makes it easy to document calls even from anonymous or first-time callers. Let's explore each scenario. Let's say we receive a call from a blocked number. The counselor can easily click the Log Call Anonymous Caller button to begin their call note. First, we will indicate what line they're calling on. This is especially valuable for centers accepting calls across multiple lines. Then we will identify call type. As you can see, call type can be customized with the options most relevant for your crisis center. Date and time of the call are automatically captured by the system. Now we'll click Next, and we can continue editing our call record. You'll see that this call note saves to a caller profile specifically for anonymous callers. Some known callers may call anonymously, in which case, Crisis Center administrators can easily reassign call logs to other profiles as needed after a counselor completes their call note. Now, let's imagine we receive a call with an identifiable phone number, but they're an unknown caller to our organization and do not have a caller profile. In this case, we'll click the Log Call First Time Caller button at the bottom of the screen and follow the prompts. Now that we've started a call note, you'll see that the CIRCE system automatically saves the note to a generic profile for the given line on which the caller called. This allows crisis administrators to easily review and organize first-time callers from a single profile. CIRCE for Crisis Centers simplifies even the most complex reporting on your crisis center's performance. The CIRCE system makes it easy for crisis center administrators to access critical data regarding center performance and call volume. Individual reports can be built based on data captured across calls and caller profiles. Each report can be tailored to your specific use case. From there, reports can be bundled into dashboards to provide a high-level visual snapshot of key metrics. Let's take a look at this dashboard designed for call review. Here we are able to see a wide range of information related to your center's overall data hygiene and risk assessment analysis. Here's another dashboard reviewing all calls from the last month. We're able to quickly identify the activity on specific lines, the most common call types, and caller-rated outcomes of calls. Report visualizations can be tailored to your needs with multiple options for color schemes and chart type. CIRCE for Crisis Centers makes call data accessible, digestible, and actionable.